And welcome to this weekly COVID-19 update, public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. And joining us, as usual, is Dr. Travis Gales, who is our health officer, and Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. Reporters, all of you should already have permission to record. If you do not, please request it utilizing the chat. And also during the Q&A portion of this presentation, request permission to ask your questions and do identify the media organization you work for. And with that, it is to you, Mr. County Executive.
So I want to welcome everybody. Good afternoon, and thank you for joining us for our weekly press briefing. Before we begin with our weekly COVID update, I want to talk a little bit about the vote at the TPB this afternoon. I think, as you all know by now, we lost the vote, and the project has been put back in. I really regret, it's clear to us that people have been under inordinate pressure, that there's been an unprecedented, negative campaign, which is largely filled with lies that came from the governor's personal political pack, as opposed to anything that actually came from the state, and has been used to really make people, I guess, worried about the consequences of what they're doing. That never should have been. I listened to people talking about people being stuck in soul-crushing traffic. They don't tell you that the people who don't pay the tolls will still be stuck in soul-crushing traffic. They talk about this project going to Frederick. There's right now is no financing plan for going to Frederick, and the state reiterated that today when I asked to amend the bill or amend the COG resolution to require the state to commit to building the project from the bridge to Frederick. They actually said, well, we can't do that now. We don't know what the funding is going to be. I thought the funding, frankly, was going to be the tolls, so that raises even bigger questions. We've worked with the state throughout. I want to point out to people that Montgomery County was the place that suggested that they actually started the American Legion Bridge. When the governor first proposed that, they were not starting there. I raised it in a meeting we were both at, and I followed him as a speaker, and I said, if you're serious, you start at the American Legion Bridge. A month later, they decided we need to start at the American Legion Bridge. We raised the issue of using the ICC to offload traffic from 495 so that people could get to 270, use whatever lanes were going to be built to get to the bridge without going to the Beltway and trying to go around the Beltway. And they adopted that. And I personally proposed to Secretary Slater, before he was Secretary Slater, that the state consider using the existing pavement, because all of us who've driven up and down there who are always looking at what's the state of the pavement, we suggested that the state use the existing pavement because there's actually enough room on that road to pretty much get 2 lanes in if you want to. Now, we've proposed, as has always been our position, that it goes back to O'Malley. So this idea this is a blue-red issue, Montgomery County was blue against blue when it was O'Malley. We suggested that they deal with 270 with reversible lanes. And we continue to believe that. Virginia uses reversible lanes. To much success. Virginia also uses the shoulder during rush hour. To much success. Any combination of those two things would reduce this cost of this project extensively. And the reason why that matters is the cost of this project drives the tolls. And the more the state rejects our efforts to find ways to accomplish what they and we want to accomplish, which is traffic relief in the corridor. But every time we talk about things that would reduce the price of the project, the governor retreats to the most expensive options possible. It seems to me that the actual P3 with his favorite company has become more important than actually solving the problem in a responsible way. So I just want to be clear with all of you and your editors that we've been engaged in trying to solve this for months. And frankly, what the council settled for was what we were going to get anyway. The first $300 million of what they got, it had already been agreed to. The second $300 million we would have gotten if and when the state goes forward with the segment from the ICC up to Frederick. And the only new money was an additional $60 million for pre-planning. If all we got was 300 plus 60, it doesn't get this project done. So we didn't get much that we didn't already have. And we didn't actually solve a single problem that the council said was a problem back when we issued a joint statement in November of 2020. I'm trying to get my years straight now. So none of the problems are solved. We've got some more money. I just want to say again, this was never about money. We never said to the state, if you give us this much money for a project, we're okay. We were concerned about the fundamentals of this and how this road is going to actually work for people. And the tolls appear to be very high. The state said a very good thing today during the meeting. The average toll sounds pretty low, but the average toll over 24 hours when the road's not going to be used for 20 of the 24 hours is very likely to be very low. The toll during rush hour is not going to be low. So clever wording is great, but it doesn't change the fact that this is not a great project. The State Legislative Oversight Committee raised serious questions about the merits of the financing package. They questioned why the governor did not do an assessment of why this could be funding or whether or not this could be funded by the state issuing the bonds instead of a private company issuing the bonds. They point out that the state could borrow for less, and not only are we paying back the bonds with their tolls, but we're paying Transurban a profit for borrowing money. So not only are they harmless on the borrowing of the money, but they're being paid to borrow the money, something that the state wouldn't have had to endure if this had been a state project, and something that wouldn't be passed on to drivers if the state had opted for a more sound financing mechanism. So we concur with the state. 76 of the 78 delegates at last count signed a letter to TPB asking them not to do this, not just delegates and senators, asked them not to support this project. So we're in pretty good company with a lot of other people who've evaluated this from an economic perspective, and we share all those concerns as well. Those concerns won't go away. Hopefully the Board of Public Works will put a microscope on the financing of this project, because every dollar they approve is a dollar that's going to come out of somebody riding that road's pocket. And if it's not necessary, we shouldn't be financing this project in a way that doesn't achieve the things that we're trying to achieve or that makes this road exclusive. I think everybody has to remember, they're taking away an HOV lane or a hot lane. They're adding 2 toll lanes. People on that road are going to be stuck with greater congestion, and the price of admission, I think the council referred to it as everybody has the option. Tolls aren't mandatory. You're right, tolls aren't mandatory. You can pay a lot of money to ride in the privileged lane, and people who don't have a lot of money will be stuck in traffic. And under the current plan, traffic at where the toll lanes end going north in the morning at the ICC is frankly going to be probably more, what's the word the governor used, more soul-sucking or soul-destroying than what the traffic is now. So it's not a transit solution. My friends in northern Montgomery County and Frederick voted for it with no guarantee that this be built to Frederick. I proposed an amendment that would guarantee that the state commit to building the road from the bridge to Frederick now. And the state refused to accept that as a friendly amendment. I would have thought that if they were committed to building this road, they would have thought it was a friendly amendment. I think it says a lot about the state's commitment that they're not ready to do that. So more on this later. I'm sure this discussion is going to go on. But I just wanted to be clear with people that we worked really hard to get to the point that we could actually make an agreement with the state. I wrote an article in the Washington Post kind of laying out our position on this, and I hope you all will get a chance to see that. And I know we're posting it in the chat. The point of the article is to say this is not about no, this is about how. And we have never said no to this project. We have continued to negotiate with the state and to work with them on design issues. We never walked away from this project and said no way, no how. And I want that to be clear. And I also want to point out that today the Baltimore Sun came out with an editorial, and the editorial says there's something to be said for the just as vital process of building a regional consensus over a huge, potentially disruptive and controversial project as the Capital Beltway I-270 plan. Better to seek further compromise than jam this down Montgomery County's throat. I really appreciated those comments. It is really difficult when you're trying to be a willing partner to have the people you're working with going on a full-out assault on you and character assassination. I hope you note that we've avoided that with the governor. None of our response to this and all of our discussion on this has been focused on the concerns we have about the financing and the actual building of the project, not on is somebody left or right or somebody's in favor of traffic. I am not in favor of traffic. And the governor should thank me for pointing out that he ought to start at the American Legion Bridge rather than pretending this was his idea. So we'll continue to work for the state. Hopefully the Board of Public Works will put a microscope on this deal and force the state to do the evaluations that they should do. So with all that said about my fun afternoon so far, I want to turn to COVID and vaccination rates. Today we find our positivity rate to be 1.22% and our case rate is 2.86 per 100,000. After seeing our daily count in single digits for weeks, yesterday we had 41 cases and 3 hospitalizations. And you can see the graphic on the screen. So we, along with everybody else in the state and the country, is seeing the spike. The good news is that so many of our folks are vaccinated that there aren't a lot of places for this virus to go. That's the good news. The bad news is children under 12 aren't vaccinated. We have a lot of people with only 1 vaccination. We've got still a large percentage of people, at least in my mind, who haven't gotten both shots. And all those folks are vulnerable. In addition, people who may have gotten both shots but are immunocompromised may be vulnerable to this new variant. So this is very concerning. Obviously, having more of this in the community means more people will be exposed to it. And that's why we're continuing our efforts to ramp up vaccinations and get as many people vaccinated as possible. We won't rest until we've been able to get everybody vaccinated who we can possibly get vaccinated. And, if your readers are out there, anybody's tuning this in and you haven't been vaccinated, we are imploring you to do the right thing and get vaccinated. It is imperative, not just for your health, but for everybody else's health, that people who aren't vaccinated get vaccinated. We are so close. And our numbers are so high that we could really put a damper on this if we can continue to make progress. Currently, over 70% of our residents have taken both doses of Pfizer and Moderna or a single dose of J&J. 70% is a major milestone, and I want to thank everybody for what you did to get us to that point. We still lead the nation for a jurisdiction over 300,000 with our rate of vaccination, which is at 90.3%. That is no small accomplishment. And 98.6% of our 65 plus population has at least one dose, which is incredible. And you don't get a 98.6 number without having to be able to vaccinate across all groups in Montgomery County, all demographics, and frankly, Republicans, people who've been in other states resistant to this. It would appear from our vaccination rates that in Montgomery County, folks are getting the message that they need to get vaccinated. Hopefully we can continue this trend. Even though the numbers are great, though, we still have these unvaccinated folks out there and the kids, and it does look like that approval for vaccines for children under the age of 12 could come as late as the midwinter, December, January. So some of us thought that might have happened in August or September. It doesn't look like that's going to be when they're going to get the clearance. So we've got a ways to go with making sure our children are safe. We've had cases pop up in our summer camps. Even if vaccinated individuals who are immunocompromised, they may be impacted with more serious symptoms. So, we're concerned. We've got kids in summer camps. Seeing those cases there is, of concern as we focus on returning to school. The American Academy of Pediatrics announced their recommendation this week that students should wear masks in classrooms. That's their recommendation as of the middle of July. We are a little more than a month away from opening schools. We'll see if that changes. But this has to be taken seriously until we can get the younger kids vaccinated in particular. I'm going to defer to Dr. Gales to talk more about this, but we're going to continue to working with Montgomery County Public Schools and our Board of Health on guidance here in the middle of July. And we should be utilizing the AAP's recommendations. I have asked Dr. Stoddard and Dr. Gales and our entire COVID response team to create a contingency plan in order to prepare us for next steps if these rates worsen. I want to be clear about that. We cannot go into something different and suddenly be asking ourselves, what might we do? We need thinking in advance and planning in advance. So if we decide we have to do something different, we're able to implement it quickly. The more quickly we operate, the more quickly we can get this under control if we need to, and if it looks like we need to take that kind of action. On evictions and rental relief, we continue to be concerned about evictions. We're actually monitoring the eviction rates. I want to thank the Montgomery County Sheriff's Department for their proactive work and engagement on this to help reduce evictions. You know, they're the group that has the unfortunate task of carrying out court-ordered evictions. I had a meeting with them yesterday, and one of the really positive signs was they're actually calling people when they get eviction orders and telling them where to go for help and how to go and how to apply to the county for additional assistance. And we know from their records that a lot of the people who were initially cited for evictions have actually been able to avoid evictions because either the tenants go for help and the county, well, not either, because the tenants go for help and the county is able to contact the landlords and assure them in many cases that we'll be able to provide support to the tenants. So we're going to continue to do our work to get our tenants taken care of. And we are focusing on the people who are getting eviction orders because that's the step you have to go through to put somebody out. So if we can stay where we are and run ahead of the evictions, we think that prioritizing that will help minimize the impact on the community. Everyone, like I said, who gets an eviction notice will be contacted by the Sheriff's Department, or most likely will be contacted. So far, we've committed $26.72 million in rent relief, and $8.2 million of this is in the latest round 3. We have more than 7,000 unique applications, and we have and will continue to add staff to help process our applications as soon as we can. And we're also working with apartment owners and landlords to help us keep as many renters as possible from being forced out. This morning, I joined our HHS department along with county council members as we memorialize our neighbors who died while experiencing homelessness or who died soon after finding a home. We had 6 homeless individuals who died of COVID-19, and I joined the community in mourning their loss and the loss of many others in Montgomery County who died during the pandemic. I also thank the providers and our HHS staff for being able to keep these numbers this low. We know that at the beginning of this, we were seriously concerned about what would happen with homeless people and COVID. And because of the actions we were able to take and the actions that our partners participated in, we were able to minimize the awful toll that this virus has taken. We've substantially reduced the number of folks who are experiencing homeless, and particularly families. And we've continued to work on eliminating youth homelessness. On my part, one of the saddest things we are faced with now is the dilemma of opening up some of our rec centers, which means putting homeless people back on the street. I have always considered it one of the great shames of Montgomery County that in a place like this, our official policy for as long as I've been here has been that people sleep outside about 8 months a year. And that's just not good. So I am exploring some ways, and I've asked a group of the homeless providers to meet with me to talk about some ideas about implementing housing that would be more stable and more permanent so that we do not have to keeping people on the street outside of the winter months. So stay tuned. But I really feel there's a moral imperative to deal with this. It's just not the right thing to do. Plus, we don't help people. If we had people in shelters, I don't know how many of you have ever, volunteered at a shelter, you will find when you're standing in line handing out food that there are people who work every day and they're homeless because they can't save the money for a security deposit and pay rent. You get students who are in college. At Montgomery College, I've met kids who are trying to better themselves so they can get decent jobs, and they're homeless. There are people who lost jobs because they lost their transportation, and when they lost their jobs, they lost their ability to stay in their housing. So whatever stereotype one has of the homeless, there are an awful lot of people who are homeless who, with a little bit of help and a little bit of support, I believe we could return to a state of non-homelessness, and we need to focus on our ability to do that. Finally, the Olympics start this weekend, and I want to wish our 5 Montgomery County Olympic athletes the best of luck in this year's games in Tokyo. The nation's attention once again be focused on our own Katie Ledecky, as well as rooting for wrestler Helen Maroulis, a wrestler returning to the games. Swimmers Phoebe Bacon and Andrew Wilson, and gymnast Kayla DiCello, I'm not sure which the Italian pronunciation is, who's an alternate, will be in their first Olympics. So I hope all Montgomery County residents tune in, root for our incredible resident athletes who are trying to bring home the gold. And now I will turn this over to Dr. Gales and Dr. Stoddard for their updates.
I know Dr. Stoddard actually has to step off, so I don't know if you had any remarks you wanted to make before you stepped off.
I just wanted to make I appreciate Dr. Gales. I just wanted to make a quick comment that if, for those who have not seen the articles coming out of Alabama today, they are heart-wrenching and unfortunately exemplary of some of the challenges that are faced across the country, but also being faced in Montgomery County of residents who have chosen not to be vaccinated. Certainly in the state of Alabama, they're seeing a significant increase in hospitalization among that population. And some of the stories are frankly heart-wrenching, with people coming to realize that this is not a hoax, and people who are begging for the vaccine far too late while they're sitting there suffering from COVID-19. And so it gives clear and stark realization to why Dr. Gales and others continue to push so hard to get people vaccinated, because we do not want people to take this lightly and then only too late realize just the severe consequences of taking it lightly. So I want to just point that out and just illustrate exactly, unfortunately, why we continue to push so hard to get those last 10% of our adult residents vaccinated, because we know the consequences can be severe for those who don't. So that's all I wanted to say today. Thank you, Dr. Gales.
No problem. And to just amplify that message, what Dr. Stoddard is mentioning and what the county executive has referenced is we continue to see cases. Obviously, the numbers are going up where we were seeing, a small single-digit number of cases each day. The state of Maryland and Montgomery County in the last 24 hours has had the highest daily total of new cases in quite some time. The overwhelming majority of those cases are in individuals who are unvaccinated. And it is unfortunate because we know that if you are unvaccinated, you don't have any level of protection in your system, you are increasingly more likely to have a symptomatic, complicated course of illness if you contract COVID. Now, I will say we are seeing more evidence of breakthrough cases being defined as individuals who have been fully vaccinated, who are testing positive, most likely due to a known exposure to another individual who's tested positive. Those individuals, from a qualitative standpoint, are not becoming symptomatic, they're not showing up in the hospitals, and they're certainly not having complicated courses of illness and having COVID-related fatalities. So all of this underscores our need to continue to be vigilant, our need to continue to emphasize to those, as Dr. Stoddard mentioned and County Executive mentioned, if you're not vaccinated, we need you to get vaccinated. It's for your protection. And we don't want to have situations such as those reported out of Alabama where individuals are about to be placed on a ventilator or having significant complications and asking if it's proper and appropriate to receive a vaccine. And as one article referenced the words of the physician who's providing that coverage, she's had to simply say it's too late. It won't provide you the protection and benefit from there. And so I don't share that to scare you. I just share that with you to share with you the realities of why we're asking folks to get vaccinated and to get protected. Now, in order to combat this, as the county executive mentioned, we have been continuing to follow the trends. Now in the state of Maryland, the predominant strain is the Delta variant that has been received a lot of attention across the world and across the nation. We are, again, continuing to encourage folks to be vigilant, to get vaccinated. We are monitoring the trends to see if there would be any need for further action to curb a potential scale up in cases and potential scale up in hospitalizations. Right now, we currently haven't seen a comparable increase in the hospitalizations and fatalities comparable to the uptick in cases. But if you recall, in our previous waves of cases, the hospitalizations and the fatalities lagged behind the cases. So we don't want to be caught in a situation where we're waiting for it to happen when we know that there are potential actions that can be put into place to curb those. So as the county executive mentioned, we are looking at what other jurisdictions have done across the country. Potentially, and some of those actions could potentially include reinstating a face covering requirement, particularly in public settings. Again, this is by no means committing to any of those, but we just want to be very transparent with our residents that we are monitoring the numbers and we want to make sure that we put forth guidance to keep all of our residents safe. Now, so just want to emphasize that and put that out there. And, at the same time, we do want to congratulate all of our residents. As the county executive mentioned, we continue to lead the country in jurisdictions of our size in terms of the percentage of residents covered. And yes, that has been based upon us putting out and creating opportunities to get the vaccine, but it's largely due to our residents in terms of heeding the public health guidance from us and from others and understanding the value and the protective levels of the vaccines to protect themselves and their families. The last thing I would reference is the county executive mentioned American Academy of Pediatrics did put forward updated guidelines that have factored in, the recent news that it may take a little bit longer to get kids under 12 the vaccine, as well as the influence of these different variants and the potential for breakthrough cases. And so based upon what has been put forward, at least from a public health perspective, I think it's a great set of guidelines. We will continue to work with our partners, both in the public schools and non-public schools, to provide guidance as they make their decisions and determinations as they bring back kids to school in the fall. That's all I have today. Happy to answer any questions you all may have. Thank you.
Thank you, Dr. Gales. Thank you, Dr. Stoddard, who just left this briefing. And thank you, Mr. County Executive. The first question actually comes from Dominique Maria Bonesi from WAMU, and it is directed to you, Mr. County Executive. Dominique.
Thank you, Mr. County Executive. Can everyone hear me all right?
Yep.
Okay. So I know that there was a work session this week on the 5G implementation of those cell towers, and a few of the council members have already stated that they would reject the bill in a vote next week. You wrote a statement, I believe, last week saying that you thought there should be a work group for more community discussion about what goes into the bill. That was something in the work group that they rejected yesterday, that they will not be putting into the bill. Is this sort of the last straw for you? Will you not vote for this bill because it doesn't have that component in it?
I don't support the bill as it's drafted. We've struggled trying to understand what exactly the industry is going to do and what the impacts are going to be on neighborhoods. We've asked the question, if by right you can put a tower in the neighborhood, say, for example, it doesn't have poles and you can put a pole in, since each radio is different for every carrier, does that mean that all three carriers, AT&T, Verizon, and T-Mobile can put their own poles in, because I can't deny service to one group and then allow it. I can't deny service to two groups and allow it for one company. So whatever we decide we do, we have to allow it for everybody. And there's a question about whether or not you could put 3 radios on one pole and what that would look like. So there are a lot of unresolved issues. We've asked Verizon to provide us. We gave them 2 neighborhoods in Montgomery County. We said, give us a map of where the actual towers would be in your mind. And they said they would provide it, but as far as I know, we have not received it yet. I think it's important because a lot of, people's opinion are based on assumptions, and neither the council nor anybody else has been able to say, this is what will actually happen on the ground if we do this. So we're hoping that we get this from Verizon and we can introduce this to the council, and they can have the ability to actually see, as well as our residents can see, where these poles would wind up going. I don't think you make decisions like this without greater community engagement. Back when I was on the council, I think there were 1 or 2 large public hearings, but there's never been a working group to try to resolve these issues. And I think the council members who suggested the working group are doing the right thing. Just for full disclosure, I have a 5G phone. I receive 5G signal. Let me see if I've got my 5G. I don't know if you can see my phone, but I'm getting 5G right now. So I'm sitting in my office in Montgomery County with a 5G phone, receiving real 5G, not the make-believe 5G, whatever they call it, 5G plus. So it's not like you can't get the signal here, unlike what some people have claimed. So we're trying to resolve, the remaining issues. Hopefully the council will buy more time, and hopefully Verizon will get us some maps so we can have a more substantive discussion. But I don't understand why people would object to a working group. It's not like everybody's got a 5G phone. They're still very expensive, and most phones aren't 5G. So the urgency of doing this minute without trying to get the community comfortable with the decision, I don't get the urgency. But it's not unlike other things.
Can I just say, after speaking with Councilman Raymer, he seems to think that a work group and those in the work group opposing the work group would essentially basically put in details in the bill that would violate the federal FCC order.
That's ridiculous. First place, a work group isn't going to write the bill. A work group's going to work with people to try to set parameters. I'm a county executive. He's a council member. None of us are putting anything illegal in a bill. And so if that's his excuse, it's probably one of the lamest excuses I've ever heard. I mean, we have no obligation to put things in that are illegal. And we frankly would be foolish. All we do is waste our lawyers' time, because we go to court. The court would say, you've exceeded your authority. You can't do this. So we could both mutually agree that neither of us will introduce legislation that's illegal, and then we can have a work group, apparently.
Thank you.
Thank you, Dominique. I do not see any more requests from the members of the media for questions. Going once, going twice. Okay.
Gone.
I was just looking at a text message from my boss, Barry. No other questions. So, ladies and gentlemen, I guess that's it for today. Thank you for joining us, and we'll see you again next time. Have a safe afternoon.
Bye.